Last week we did, I think it was 2 weeks ago, we did a special live Q&A regarding COVID-19. And obviously with everything that's going on with the protesting, COVID-19 has taken a secondary story. And I think it's important to bring it back to light because cases are increasing around the states. There's many countries that are hitting all-time highs, including Brazil. And we have to remember how serious COVID-19 is, especially, of course, for those who are more vulnerable, our elderly, those with preconditions. So I wanted to do a second live Q&A with an expert to make sure we are as educated and equipped to stay healthy and to make sure we're doing all we can to protect not only ourselves, our families, but everyone else. So once again, we are adding Dr. Davidson Kong, who is a bioengineer and synthetic biologist at MIT and a founding member of Beat the Virus. If you haven't followed Beat the Virus, make sure you do so. But yeah, this is an educational. Here he is, the man, the myth, the legend. How are you, Doc?
Oh, I'm doing wonderful, TJ. So lovely to see you, my friend. How are you doing?
I'm good. I'm very, very good. I'm seeing all my comments. People are commenting. I shaved. So let me just address this real quick. But yes, I do have a baby face trying to compete with you uh, with that
Well,
young look that you have. But
I'm trying to look as good as you, man. Well, we were talking about this last time. I think we're just about the same age. We're both a bunch of 40-year-old guys looking, handling our baby faces pretty well so far. So,
hey, that's it. I haven't shaved in a while, but I'm not the best at it, and I went too far on one side. So I was like, I got Dr. David tomorrow morning anyway. I might as well shave it off and compete with him. But how are you doing? You doing well?
I'm doing well. Thank you so much for asking. Yeah, obviously, we're in some historic times right now, both with the pandemic, but now also this really amazing movement around social justice and
Yeah,
civil rights, it's a challenging time, but I think also an exciting time.
yeah. Uh, I have to completely agree with you. It's been a different type of 2020, but I think it's one that at this point we have to figure out how to progress and make necessary changes and stay healthy, of course. And I'm
Yes.
happy that you came back and you're here because I've still been getting a lot of questions from people all around the world asking COVID-19 questions. And I don't feel comfortable asking them myself. So I'm happy you, the COVID-19 expert that I know, is joining us to do so. Um, I'm going to get to some of their questions. And for all of you who are watching this, I have questions that some of you guys asked on my stories, but feel free to ask them here in the comments section. I'm going to try to keep my eye on the comments. But before I do that, I wanted to ask you, Doc, a couple of questions.
Of
It
course,
seems
yeah.
like it seems like cases are rising again in many parts of the country. Um, I don't know how much of that is related to protests or not. I know it usually takes a couple of weeks for us to start seeing the effects of COVID-19 being transmitted and spread. So I'm not sure how much is related to that. I know a lot of country or a lot of states opened up prior to the protests, so I'm not sure if that was what it is. Either way, it seems like it's coming back in various parts of this country, and it's hitting all-time highs in other parts of the world, such as Brazil. So it's a very serious, real thing, and it's one of those things where we may ignore, but when it hits us personally, then we're playing catch up. So again, thank you for joining us. And here's my question: coming off those protests, we still have protests throughout the world. They're not. I don't think they're as big as they once were. But for anyone who wants to go and protest, what do you recommend they do or we do to make sure we're doing it safely?
Yeah, that's such a fantastic question, TJ. And just to say really quickly as well, I think to your point, COVID-19 has not gone anywhere. COVID-19 is still there, and as you mentioned, it's very much a threat in many parts of the world, and also in the United States. Right now, today is June 11th, 2020. Right now, there are 19 states in the United States where COVID is on the rise. And Arizona right now, in particular, is one that people are looking at very carefully because again, you remember going back a number of months ago, our whole one of the whole reasons we all had to lock down and shelter in place at home was because we wanted to flatten that curve. We're really worried about our hospitals. We're really worried about so many sick patients getting infected at once that require hospitalization, that you run out of hospital beds, and that our healthcare systems can't care for those patients that need it. And that's what's starting to happen in Arizona, right? That's what
Yep.
happened in New York. We saw that so vividly. And in Arizona right now, we're starting to see that capacity get reached, which is really scary. And so again, 19 states now, the number of cases is increasing, which is at rates that we really don't want to see. Now, I'm in Massachusetts right now. I feel very lucky. Massachusetts is one of the really hard hit states early on in the pandemic. Massachusetts, New York, New Jersey, we were all hit really hard. But Massachusetts right now is actually, I feel very lucky. It's one of the safest places to be because the number of COVID-19 cases has been really brought down very, very low. All of the indicators that you want to look at in terms of the number of confirmed cases, the percentage of positive tests, and this is a really important one, right? So we've heard a lot about testing and the amount of testing and so on, but the number that you really want to look at if you can is the percentage that is testing positive, right? So you want that number ideally to be like below 10% if you can, ideally below 5%. And in Massachusetts right now, it's like 3 or 4% is testing positive. That means you're testing lots and lots of people, but only a very, very small number of those people are actually showing up as being infected. When that number is very small, that means that you've got the outbreak pretty well under control, right? When things were really bad in New York, that number was like 25%, 30%. That means that almost a huge number, a percentage of the people that you're testing actually have it. And that means you've got a lot of spread. And so unfortunately, in many of these states, I mentioned there's 19 currently where it's still going up. That percentage is high, and it's above 10% in many cases, which is not what we want to see. So I think that's the first part, is that COVID is here and that we still need to do everything that we can to stay safe. And so back to your question about how do we stay safe during protests? Again, I think for me right now, the pandemic has been really terrible and has had a terrible impact. But my gosh, the collective consciousness and the awakening that were happening globally around racism and systemic injustice, it's so inspiring. And one of the best ways to go and show support and solidarity for this global movement is to attend a protest. But I do think there are a number of really important things we have to think about before we decide whether or not we're going to go. So the first thing I would ask myself is there somebody vulnerable that I live with or that I'm in close contact with that I potentially could bring the disease home to if I get infected, right? So I think that's the first question you have to ask. So as an example, my mom, there've been periods where I've had to take care of my mom. She's an elderly mom, and she's part of that demographic that would be at risk for COVID-19. And so for myself, for example, if my mom were staying with me and I had to take care of her, I would not put myself at risk to go to a protest, even if the risk at the protest were low. And I'll talk about, again, a little bit about how we can keep that low. But that's the first question you really want to ask yourself. Is there somebody vulnerable that I might bring it home to? And if there is, again, it's all about risk. It's all about evaluating risk. So you may decide that the risk of bringing it home is too high. So that's the first question. The second question you want to ask yourself is, how much COVID-19 is there in my area, right? And again, each state is tracking all of those numbers. So, with a quick Google search, you should be able to figure out how prevalent COVID-19 is right now in your region, wherever it is. And of course, you've got global fans. So again, understanding how prevalent it is very, very important. And again, I would be looking at things like what I mentioned, the percentage of tests that are coming back positive. That's a really good number to look at. But then also just what are the trends? How many hospitalizations are there? How many people, is the number of cases rising or going down wherever I am? As I mentioned, in Massachusetts, where I am, the trends have been so good. The number of hospitalizations are going down, the number of deaths are going down. And so right now, there's just not a lot of COVID-19 in Massachusetts. So for myself, last week when I was asking myself, hey, David, do I want to go to the protest for myself? I decided, yes, I would go. In part because I don't have anybody in my home that I'm living with that I would be worried about infecting. And then two, there's not a lot of COVID-19 in Massachusetts right now. So that was something that made me feel a lot more comfortable about. So that's the second question. How much COVID-19 is there in your area? Another important question to ask is the protest outdoors? Okay. One really good thing right now is that basically every Black Lives Matter protest is happening outside. And so really the studies are showing there's a pretty strong consensus that COVID-19 is primarily an indoor transmitted disease, right? It's transmitted when you're sharing physical space with somebody and critically sharing a lot of air, right? If we're sitting in the same room together and we're talking or singing or chanting or whatever, and we're putting out respiratory droplets and we're in a room, that's the time where you can see a much greater risk for infection. And so being outdoors, fortunately, is one of the safer places to be. So when you're outside, you're basically kind of in a place with infinite air around you. So when you cough or sneeze or talk, that gets diluted and it gets kind of circulated everywhere. So and again, another really important thing to keep in mind, your risk of infection is a function not only of the dose, like if I cough on you or if I'm near you at speaking, but also the amount of time of exposure. So if you and I, TJ, are hanging out and we're having a long conversation, for an hour or two, that increases our exposure versus if we just see each other walking and say hi and just pass each other, right? Gotcha. That's not a lot of time, right? So again, is it outdoors? That's another key question. And in general, COVID-19 is outdoors. Another thing to consider, again, when you're talking about protests, is how widespread are masks, okay? We can talk a little bit more in greater depth about this, but masks are probably the simplest, most effective way to actually protect yourself and protect others and overall reduce the risk of transmission. So again, at the protest that I went to last week in Boston, it was really wonderful. The mayor and the state or the city of Boston were distributing masks. So right when we got to kind of the start of the march, so it was a march that went through part of a park in Boston and then ended up in a rally, and there were volunteers handing out masks. And TJ, it was inspiring. There were thousands and thousands of people there. So on the one hand, from a social justice perspective, that got me excited. But then the other thing that got me really excited was that every single person there had a mask on. And I was paying attention, right? I'm super, of course, worried about public health and COVID-19, and it was universal. I did not see a single person in that crowd that was not wearing a mask, okay? And so the fact that the event was outdoors and that everybody had masks on also made it so much safer. And so, those are other aspects. Another core thing to think about too is the protest a march or a rally or a combination of both? The reason why I bring that up is if it's a march and you're outside, you're moving, right? You're moving, and so the likelihood that again, you're going to have a lot of exposure and spend a lot of time exposing somebody else or getting exposed is just lower because you're moving, you're on the move, and it's also easier to keep your distance, right? If I'm marching and I'm walking, I can actually just keep myself a few feet away from the person right next to me, right? So that's a lot safer. Marching is a lot safer than rallying. If you're at a rally, and now if let's say we're all packed in together and we're listening to somebody speak, that is going to be more dangerous, right? So now I might be sitting next to somebody, they may be infected, I may even be infected, but if we're sitting next to each other for, again, a longer period of time, then we also increase the risk of exposure. Even if it is outside and even if we're wearing a mask, at the end of the day, marching is going to be safer than a rally or a place where you have to stand still and be around other people in close proximity. The final thing I'll say too about protests is that, again, one of the most cathartic part about, I think, being at a protest is chanting, right? Chanting, being able to, work with the people around you and just, kind of share whatever's being chanted. And it's such a cathartic, therapeutic thing to do. Mm-hmm. But again, anytime you're yelling, singing, that's when you're putting out those respiratory droplets that have the virus. So that's why wearing the mask is so important. If you wear a mask, go ahead and chant and do your thing, but you've got a face covering, which will help prevent that transmission. So those I think, are some of the big factors.
Well, thank you for all of that. One thing, and I don't think there's that many people who feel this way. I think the majority believe COVID-19 is a legitimate issue and a legitimate threat, but there are some out there that feel it's not real and that it's kind of the media overblowing it. Real quick, before you answer that, I want to state something on that. My perspective of this is this, because I think a lot of people who say that feel it's a political thing, as if it's something that the Democrats or the left side has done to try to sabotage Trump and his economy. But my issue with that is, what about the rest of the world? They're not in political season. They're not in voting season. And it wouldn't be such a big deal all over Europe and in Brazil, like we said, if that were the case. But that wasn't a question for me. I wanted to know, what do you, if I'm walking or if I'm talking to a friend who, and I know someone who's had it, I know several people who've had it and were fearful for their life like nothing else. I actually know someone who's passed from it. But besides that, if I wasn't in that situation and what should I tell someone who's trying to downplay it and tell me it's not real? What would you say to that person? What kind of
Yeah,
ammunition would you tell me to let them
yeah,
know it's a serious, real thing?
yeah. Well, I would say, right now, again, June 11th, there's 7.5 million people around the world that have been infected with COVID-19. More than 400,000 people have died. I mean, in the United States, we have more than 115,000 people that have died from COVID-19 in just a few months. Okay. In many states, it's the number one leading cause of death right now is COVID-19. More than heart disease, cancer, all of these other diseases. Okay. So it is a terrible toll. 115,000 people dead in just a few months. I mean, that is, that's more lives than were lost from the United States in the Vietnam War, for example, right? So it's a killer. It's something that is killing so many, 800 to 1,000 people per day are dying in the United States right now from COVID-19. And if you do the math on that, right, between now and September, we could easily have another 100,000 deaths. So 200,000 deaths by September just in the United States. Okay, that death toll alone should hopefully make anybody pause and just reflect on the magnitude of the suffering.
Doc, what would you say is an average type of loss of lives in a regular flu season?
That's a great question. That number varies year to year depending on the flu season. So that can be tens of thousands of deaths to more. But again, I think in comparing the flu and COVID-19, there are two key questions about, and again, a lot of people talk about flu versus COVID-19. The two elements are, how infectious is it? How easy does it spread? And then secondly, how deadly is it, right? And from all of the data that we're seeing, the COVID-19 is at least looking like to be at least 10 times more deadly than the flu, and also definitely more infectious, potentially several times more infectious than the flu, which is part of why we've seen the disease spread so wildly. And again, I think, to some of the points you were making earlier, there's the number of dead, but also just the impact globally and around the world. I mean, hundreds of countries all around the world have had to shut down because of this exact problem around flattening the curve. We've had healthcare systems just totally overwhelmed because of the severity of the infection and also the number of infections that are happening all at once, right? We've seen this over and over and over again all around the world, throughout Europe, Italy, France, Iran. Latin America right now is suffering terribly from COVID-19. Brazil, Ecuador, so on. So I think those are some of the key elements to think about when talking about the severity of the disease, is just the horrible impact that it's had. And again, it's not, the flu doesn't shut down hospital systems, right? Cancer does not shut down hospital systems, and heart disease doesn't either, right? We're talking about an infectious disease that can grow and spread incredibly rapidly and is a killer, is a very deadly disease. So until we figure out how to get better therapies for it to reduce the deadliness of the disease, and of course, ultimately having some type of protection like a vaccine, the whole world is in a very, very dangerous place.
Okay, so loyal TJ Jackson fans wants to know, are we close to finding a cure for COVID-19?
That's a phenomenal question. So I want to emphasize here that the difference between a therapy and a vaccine, right? So a therapy is basically like a cure. Like, if I get sick with COVID-19, is there something that I can take that will actually make me get better, right? For flu, we have things like Tamiflu. And obviously for lots of other diseases, we've got other types of medicines that will work. For COVID-19, because it's a new virus, we're still doing all of the research we can to try and figure out if we can develop these therapies. Now, there's currently one therapy that has been shown through lots and lots of study that it does look like there's a reasonable clinical impact, and that is a drug called remdesivir. Okay, so remdesivir is basically the one drug that we know about right now that has some kind of impact. And remdesivir actually was developed to tackle another virus. Ebola actually was one of the drugs that it was originally designed for. But we've been studying it because it's already gone through certain levels of a clinical trial and approval to adapt it to COVID-19. And so that one has shown to work and have some impact. And it reduces the number of days of hospitalization, for example, by a few days. So that's really good. The challenge there is we're running out of it in the United States, right? So there's concerns that we're not going to have enough remdesivir to last us through the summer, for example. And so there's a lot of effort that's underway right now to actually ramp up the production of it so that we have enough of it for the fall and beyond. And so again, we're optimistic that we'll have something, we'll have more of it. But that right now is the one therapeutic that we know about that does have some impact. But the good news is there are many, many other therapies that are in development right now. And so again, anytime you have to develop something like a therapeutic or a vaccine, and again, as a reminder for everybody, a therapeutic is something you get when you actually are sick and you want to get better. A vaccine is something that you can take to actually get your immune system to be prepared to fight COVID-19 before you even get it. So you've got that protection so that if you encounter somebody that has COVID-19, you yourself will not get sick. And again, we take vaccines for things like the flu. We've eradicated many, many deadly diseases off of planet Earth because of vaccines, things like polio and so on. So, and both right now, the good news is both on the therapeutic front and on the vaccine front, there are hundreds of candidates that are now being evaluated and are in clinical trials. So we're going to learn a lot more in the coming months about more effective therapies and more effective vaccines.
I always wanted to know, with those who are the first ones to test a vaccine, how does that work? I mean, I wouldn't want to be one of the first ones to try out a vaccine. First of all, how are they kind of chosen? And then also, what kind of insurance should I have in getting a possible vaccination within a year of finding out about a virus?
It's a great question. So exactly what you talked about is the purpose of the clinical trials. So you may have heard, it may take 12 months or 18 months to actually get a vaccine to the public. The reason why it can take many, many months, and in some cases years. I mean, again, there are diseases that we would love to have vaccines for, things like HIV, for example, which is a very, very terrible disease, but we still haven't been able to develop vaccines for a lot of the diseases we'd love to have them for. And so one of the big parts of that process, though, is the clinical trial. And clinical trials are basically designed specifically to test a couple of factors. One, is it safe, right? Is it something that actually the population can take and basically take it safely? And so there typically are several phases in these clinical trials, and a huge element is testing safety. And so you'll do it typically with a small group first, and then get progressively larger and larger groups that you study over time to see, one, is it safe? The second part about clinical trials that are really important is testing the efficacy. Does it actually provide you some level of immunity? If I actually have this vaccine, is it going to be effective and help keep me healthy and prevent me from getting sick? And so that's the whole purpose of the clinical trial. And the reason why it takes so long is because you need to study the people that actually take the vaccine and then see how they do over time. We study things like the dose, the amount of a vaccine to give. Are there other kind of what are called adjuvants or ways to actually make the vaccine more effective, right? So these are all a big part of the trials and why they take a long period of time. And then after you prove that they're effective, then you have to make it, right? For something like COVID-19, we're going to need billions of doses of this drug. And it's not, it's not just like, brewing some beer or making a small amount of stuff. Like you have to actually produce a lot of this vaccine. So all of those factors are part of why it takes a long time. But again, critically, the reason why it takes so long is because we really want to make sure the vaccines are developed safely.
Chloe wants to know, Dr. David, what is your opinion in schools reopening again so soon? I know some schools, most schools I think in the States are still doing distant learning, but I had heard that many schools in France give you the option of whether you want to send your kid or not. What's your opinion on schools reopening?
Yeah, so I think it depends a huge amount on where you are, right? So in places like Taiwan or New Zealand, Hong Kong, because they've been able to control their outbreaks, and again, you may have seen this in the news just very recently, but New Zealand now has essentially eliminated COVID-19 from their entire population. All the people that got sick from it have recovered, and they basically are effectively 0 cases of COVID-19, then obviously it's a lot safer to go to school. And so there's school children there. Schools are open. They're basically kind of behaving almost like normal before the pandemic. And so similarly, if you look at some of the Asian countries that have managed to control the outbreak, places like South Korea, Taiwan, Hong Kong, even, they have schools open, and it is much safer there, right? In the United States, again, I would look state by state to see what's going on. And again, there are always risks, and a big part of that, one of the big challenges is, we still don't know exactly what's going to happen, right? There's a way parallel experiments that we're all conducting to see are the different mitigation strategies that we've developed effective at ultimately reducing transmission. So we're starting to see things. For example, I teach at MIT. We're still debating whether or not to have students back on campus. A number of other schools have taken an approach of, for example, having a shorter semester where they'll start the school semester a little bit early, but then end it earlier as well. So, for example, even before Thanksgiving, there's some universities that are pursuing that strategy, so that we can get all the students home before the winter part really kicks in. In part because there is some thought that going into the winter there may be potentially another wave of infection that could happen. So I think there's no easy answer, unfortunately, on schooling. The one good thing, again, as we've talked about before, is that young people in general do much better with COVID-19, or at much less risk of a severe case or hospitalization. However, the challenge there, though, is there somebody that I'm living with or that I have close contact with that might be elderly or immune compromised that could ultimately suffer if I bring it home?
Got it. One question I also had, and I'm seeing it a little bit in the chat and on the questions from before, are the effect of gloves. So if I put on a glove, I went out yesterday, I had gloves on, and I had them on for about 2 hours while I was, touching door handles and things like that. Yep. Is there anything on the gloves that help protect me? Because if I shake someone's hand or something like that, I didn't do that, but let's say I just touch things with my glove, is it pretty much in essence of me the same thing of having hands? Like, is gloves just effective for once I take it off, then I'm good? Or is there something actually that the gloves do that actually kind of neutralizes the virus?
Yeah. So the gloves do not neutralize you, and have it on your gloves, it'll stay on the gloves itself. So that's why, again, when you have gloves on, the critical elements are still to not touch your face. So the reason why you want to wash your hands, or why gloves may be effective, is because you want to make sure ultimately that you're not touching your face, because that's where the transmission happens. You don't get COVID-19 by getting the virus. You aren't infected with COVID-19 by getting virus on your hands. You get it by actually transmitting it through the mucous membranes that are in your mouth, your nose, or even in your eyes. So that's why you don't want to touch your face. Just wearing gloves doesn't necessarily protect you. If you wear the gloves and are not touching your face, then that, of course, is really, really good. And so, for example, for myself, sometimes I've done this in the past where I might go to the grocery store. I'll put on gloves right before I go to the grocery store. When I'm in the grocery store, I will have gloves on, I'll pick up my groceries and so on. And then as soon as I leave the grocery store, I'll take the gloves and I'll throw them out. Also, still use not a bad thing to do either. But gloves, again, just wearing gloves doesn't magically protect you from COVID-19. The thing you want to make sure you critically don't do, and gloves sometimes can help with this, is just to not touch your face, right? So that's one of the big things, just not touching your
do that. Okay, Tori wants to know, are kids less sensitive to COVID-19?
Yes, so far it looks to be that in fact is the case, that children in general are, or at least they have much less severe symptoms and are much less likely to require hospitalization. If you look at just the number of folks that are actually getting sick from COVID-19 and end up with severe cases, the vast majority is elderly folks. Particularly if you get above 70 or 80 years old, that's where so much of the deaths and the very severe hospitalizations are occurring.
I'm sorry, I'm not going to. Disha Gupta wants to know, Dr. David, after a patient recovers from COVID, does he develop natural antibodies, thereby reducing his susceptibility next time?
Yes, from what we know about COVID-19 and in general for coronaviruses and other types of viruses is that after you are infected, when you recover, you do develop different types of antibodies that can give you some measure of protection. Now, one of the things that we don't know well enough yet is how much protection and for how long, right? So as we've talked about in the past, COVID-19 is a disease that's caused by a virus, SARS-CoV-2. Okay, so SARS-CoV-2, that's a technical name for the virus. That's a virus that's part of a family of viruses called the coronaviruses, which I think people are pretty familiar with by now. There are a number of coronaviruses. There are 7 or 8 of them, and a number of those viruses cause the common cold and have actually been in circulation in the population for a while. And so those viruses, you can actually get sick, get something that looks like a common cold, and you'll develop some immunity to it, but it's possible to get reinfected with it maybe even like 6 months or within a year. So you may not have long-lasting immunity for some of these coronaviruses that, for example, cause the common cold. Now, some other coronaviruses, like SARS is the first one. It's again, severe acute respiratory syndrome. The immunity there has been shown to potentially to be a little bit longer lasting than the ones that cause the common cold. And so what we don't know yet about COVID-19 is just how long and effective that immunity is. And also we don't know quite well yet if that immunity is connected to, for example, how severe the disease is that you end up getting. So those are all elements that we're still learning a lot about, but hopefully we'll know a lot more about over the months to come.
So this is sweet. Dr. David, hi, my name is Madigan. My grandmother has COVID. My question is, what could cause the symptoms to become respiratory? That's what she's saying. Doc, what could cause the symptoms to become respiratory?
What could cause the symptoms to be respiratory? Yeah, so I think one of the real big it impacts so many different systems of the body. When we were first learning about COVID-19, we really thought it was primarily a respiratory disease. But then we saw all kinds of other symptoms, right? We've heard about losing your sense of smell. We've heard about different cardiovascular impacts. We've heard about these other inflammation related symptoms. And so there's now an emerging hypothesis that actually that COVID-19 is also really impacting blood vessels. And so that may also help to explain why it's attacking so many different parts of the body, not just our lungs and our breathing, although that certainly is one of the key areas. Again, one of the top symptoms when you actually get COVID-19 is fever. So some, 80, 90% of folks that present symptoms to COVID-19 actually end up having a fever. So that's one of the big things to look out for. But then certainly coughing and other respiratory ailments are also very strong symptoms that present themselves as well.
Another question that I can't scroll through, but is the relation to the virus to temperature. Some people are asking, is there a link between high temperatures and lower cases or lower potency or lower transmit, whatever? Is there a link between temperature and COVID-19?
Yeah, exactly. So there's a lot of studies. So that's the question in a way is seasonality, right? When it gets warmer outside, when it gets to summertime, does that actually help and impact or reduce the rate of transmission? What we're seeing right now, obviously, even looking at places in the Southern Hemisphere, places like Brazil that are getting really pummeled right now. If we're lucky, there will be some level of impact or reduced transmission. And part of that is because when you have more humidity, when you have higher temperature, the virus is just a little bit less stable, and it's not as easy to transmit if you've got greater humidity, for example. And also when the temperature tends to be higher, people tend to be outside more, right? So for example, the flu tends to be seasonal in part because people are outside, and much like the flu, some of these respiratory illnesses, they're transmitted more easily when you're inside more. So we're starting to see, there are some seasonal impacts that we're seeing, but one of the unfortunate parts, I think, is that even though the temperature can get warmer or be warm in a place like Brazil, we can still see very much significant spread. And I think we're seeing that even right now in the United States with the rise in cases in places like Arizona.
Nice. Okay. Xmas61 wants to know, do you think we can get a second spike? And is a vaccine our best hope for normality?
Yeah, that's one of the big questions that I think everybody has on their minds, the research community, public health experts, and so on. Um, the short answer is we're not going to know for a little while. Some would argue that we're still in our first wave, right? Again, you look at places even like California, they've been able to bring the cases down, but it's kind of flat, right? So there are places like, for example, in Massachusetts or New York, where we've really brought in, there really is a peak, and then it came all the way down, and we're really kind of effectively reducing the amount of spread in places like Massachusetts and in New York. But for many parts of the country, you could argue that we're still in that first wave. So I think whether or not we're going to get a second wave, I think is going to vary a lot state to state. I'm optimistic in a place like Massachusetts, for example, that we've brought the number of cases down such that, one, if we have enough widespread testing, and then I mentioned this a little bit last time in our last live, I'm talking about something called contact tracing, which is basically a way for us to identify the people that are sick and then isolate just those people, get those folks out of the population so that they can recover and not infect anybody else. And that is one of the most effective strategies that's been used in places like South Korea and Taiwan to keep the outbreaks very manageable. And so in places like Massachusetts, I'm hopeful that we've been able to bring our cases down low enough that we can test widely, do a lot of contact tracing, and prevent that second wave from coming up.
Just past September, wants to know what kind of mask we should wear. I like to personally wear the doctor's surgical mask because they're light and easy. But by doing that, am I kind of negating the purpose of wearing a mask in general?
Yeah, fantastic question. So there are really three kinds of masks to consider. One type of mask that you may have heard about is something called an N95 mask. N95 masks offer the most protection. They're extremely good at filtering out the respiratory droplets and so on. But those are typically really ones that we should be reserving for our healthcare workers. There's limited supplies of those masks still. And so really having our frontline responders and those that are in medical settings, having those masks is really important. But for the rest of the general public, cloth masks, the surgical masks that you mentioned, the disposable ones, those are all still effective. And again, I think this is a huge message to get out there to everybody right now, is when you're outside in public, wear a mask. Just do it. It's the single most effective thing that we can do to keep ourselves safe and also to reduce the rate of transmission. And if we have enough people wearing masks, just doing that by itself can really stop COVID-19 in its tracks. So in the past number of weeks, it's just study after study really confirming this. Just a couple days ago, the University of Cambridge released a study showing that even if 50% of the population wears a mask, we can bring down what's called the reproduction number, which is the reproduction number is basically the number of people that any one person might infect. And so when that reproduction number is high, let's say it's 3, then I might infect 3 people when I'm sick with COVID-19. And again, COVID-19 has had a reproduction as high as 3, sometimes even higher than that, depending on where you are in the world. Just 50% of the population wearing masks can bring that reproduction number below 1. And that's where we want to keep that R number is below 1. Because if I'm infecting less than 1 person, right, then over time, you're actually going to bring the rate of transmission and the amount of people that have COVID-19 down over time. If it goes above 1, then you're going to see the rates go up. Okay? So it's really, even if we can get just 50% of folks to do it, you have a really big impact. And of course, if we can get even higher than that, 70%, 75%, 80%, or 100%, we can really, really stop, slow down, or completely stop the spread of COVID-19. So I really can't emphasize enough how important it is for us to wear masks. And just as another anecdote about masks, let's take a look at a place like Hong Kong, okay? Hong Kong has got a population of 7.5 million people. And again, the United States has got about 330 million people, okay? Again, in the United States right now, we've got about 2 million cases, all right? And Hong Kong, take a guess how many cases they've had. Put this out there for you, man. Any thoughts? Pick a number.
7 million. It should be. I mean, I would say because it's concentrated, it should be higher than what we've had. But I'm gonna get a bit lower. I'm at how many cases? I would say 150,000 cases.
1,500.
Oh my goodness.
1,500 cases and 22 deaths.
And is that
Or
because they
four deaths,
just
sorry.
is
Yes.
that because there's always been an acceptance in their society to wear masks from?
Yes. Yes. It is thought that the biggest impact that the reason why Hong Kong has been able to keep their number of cases and their number of deaths so low is because of the number of folks that are wearing masks. So there was a study that came out in the Lancet in the beginning of May that was basically looking at the percentage of mask wearing in Hong Kong, and it's upwards of 95%. Okay,
Wow.
so if you've got almost universal mask wearing in a place like Hong Kong, which is as you know, it's an extremely dense city. It's like New York. I mean, people are
Yeah.
living on top of each other. I mean, it's extraordinarily dense. But they've been able to keep their number of cases. I misspoke earlier. It's 1,108 cases. Okay, that are
Wow.
confirmed. Okay,
Wow.
so just from wearing masks, you can really put a huge dent in the transmission of COVID-19.
Vanessa, and there has been a couple others that wanted to know. Dr. David, is hugging really a problem? Isn't it mostly transmitted via long-term contact?
Yeah, that's such a great question. I mean, again, I love my hugs too. And humans, we're all social creatures, right? I think, one of the reasons actually I don't like the term social distancing is because it makes it feel like we still have to avoid, human interaction or feeling kind of connected to other humans, right? I prefer the term physical distancing, right? Right now, more than ever, I think we need to be showing love and compassion and kindness to each other, but we just need to stay physically away from each other so we don't spread the germs, right? So hugging, unfortunately, it just brings you in a closer proximity, and it's just easier to potentially infect somebody. If I cough and I am 6 feet away from you versus I am hugging you when I cough, or even if I talk, right? Even speaking right now, as you and I are talking, there are respiratory droplets that are flying out of my mouth just as I talk, right? So unfortunately, this is the likelihood of infection. So, but I've seen some really creative things. I've seen people people have kind of whole suits on almost. They're like like a unicorn outfit or whatever. Like get into a bubble and then you can hug that way. So in a way, actually, one of the big questions, and this is for the designers out there, how can we design barriers or ways so that we can still hug each other and still have like kind of close proximity, but help to prevent that the spread of the respiratory droplets, because that's the whole thing, right? We're just trying to keep people from spreading those germs around, and if there are ways for us still to hug while doing that, awesome, right? But unfortunately, that's something that we still have to be really, really careful about, especially if it is, one of our elderly parents or grandparents or somebody that's immune compromised and might really get a bad case of COVID-19.
Kit Kat Michael wants to know, can you get the virus a second time, or are you immune from the first time?
Yeah, so this goes back to the conversation we were having earlier about immunity and how long immunity you might have after you get infected, and also how strong is that immunity, right? And we still don't quite know the answers to that question yet. So we're waiting to see. But I think the good news that we're seeing so far is that for folks that have been infected, and again, there's millions of people, 7.5 million people on planet Earth have been infected with COVID-19. We're not seeing much in the way of reinfection thus far, right? Again, it's a novel virus, and so it's brand new to humans. And at least in the months since this first wave of infection has occurred, we're not seeing much in the way of reinfection. There were some news reports earlier out of South Korea that maybe there were people that are getting reinfected, but it's looking like that it actually wasn't reinfection. It was just that they were still evidence that they were shedding the virus even after they had recovered. So they didn't get sick again. They had recovered, but the test was coming up positive because they were still shedding virus even after they had recovered, but they weren't sick again. So I think there's reasons to be encouraged that after you get sick, you will have a level of protection for some period of time, at least a few months, because it's been a few months and we haven't seen, we've only heard anecdotes about reinfection as opposed to seeing real studies looking at that.
Sienna wants to know, can COVID-19 be transmitted through animals and pets at all?
Yeah, that's a great question. So COVID-19 and so SARS-CoV-2, which is the virus that causes COVID-19, everything we know about the virus suggests that it actually came from bats, right? So there's a whole process called zoonosis where a virus can hop from one animal species to another. And so we see that with viruses all the time. And we've even seen stories about, I think there was a story about I think it was a tiger or a lion in a zoo that tested positive for SARS-CoV-2. And so it is also possible cats have gotten infected as well. Now, what we don't know is it easy or possible for like a pet to get it and then give it to a human? From everything that we've seen so far, the risk of that happening is very low. If it's happened at all, I think that's not something we've seen. In general, the way that you get SARS-CoV-2 or the way that you get COVID-19, as we've talked about, is infected, right? That's really the main way to get it. Pets, I think, are extraordinarily low risk.
Now, what about water? Swimming pools? Yeah, swimming. Can you find virus in the water?
Another great question. I haven't seen as much in terms of studies about water and swimming pools, but intuitively, again, if you're in the water, if you did cough or sneeze or so on, you're instantly kind of diluting the the droplets again. So the virus becomes diluted in the water. So that's one aspect that reduces risk. But I would wait to see more studies on that one. That one I haven't seen a lot yet about safety in terms of pools, but that's a good one to look into. I can look into that and get back to you on that one, TJ.
Here's another good question, I think. Well, is it true that people with blood type O are less likely to get the virus? And I'm going to kind of piggyback on that. Is there any type of blood type or any type of anything that seems to be more favorable for you not to get the virus?
Yeah. So some of the initial studies are looking at blood type, and so O is in fact one of the ones where, for whatever reason, again, I think it's important to say this. There's a difference between correlation and causation. So there are studies that are showing that folks with blood type O are there are fewer people with blood type O that are confirmed to have the virus. We still don't quite understand yet why that's the case. What is the source of that that correlation? But we are seeing evidence of that. So yes, that is an element. Now, I would say though some of the other aspects, high blood pressure is shown to be a key factor in severity of disease. And so there are a number of those health elements that I think are very much worth watching. And obesity.
This is another good question from Applehead Love 27. What food should you eat if you have COVID? And I'm going to ask another question. Is there any type of food we should eat to try to bolster up our immune system to avoid getting COVID? Yeah.
So in terms of foods that you should be eating, here I think there's still a lot of studies being done about are certain vitamins, for example, impactful in reducing the severity. Number of different studies and ways that people are experimenting with this. I would say for now, use your common sense when it comes to protect your immune system and your own health, right? We talked a little bit about this last time, but just having a real healthy diet, hydrating, getting a lot of good sleep, all of those kind of common sense steps, getting a lot of good exercise, those are all really, really positive for just improving and boosting your own immune system. So I think those are the elements that we should all be doing anyways to protect ourselves and make ourselves healthy and safe. But in particular for COVID-19, I think getting your immune system well supported steps is really have COVID. I think that's another that's a tough question. I would defer more to some of my medical colleagues to answer that particular one. I don't know if there are particular foods that have been shown to be more effective, but again, I think in general for your immune health, do the common sense things. Eat your veggies, eat your fruits, and I got a sweet tooth, but I try to cut down on my sugar too. So.
Okay, this is another great question. What do we do if we touched a person who is the question is vulnerable to COVID-19, but I'm going to add to it and say, what do we do? First, you can answer that if someone's vulnerable, but what do we do if we touch someone that we COVID-19? Did I cut out on you, Doc?
I lost you for a second there, yeah.
Okay. What do we do if we touch a person who is vulnerable to COVID-19? But also, what do we do if we touch someone that has COVID-19?
Yeah, it's a great question. So I think if you can do it, go get tested. If you feel like you've been exposed, then the most important thing you can do is to go get a test. And going back to the point about protests again, for those that have been to protests, if you're able to do it, I would strongly recommend and encourage you to go get a test. And the reason why, of course, is if you know that you've got it, then you can stay home, take care of yourself, and then make sure that you're not infecting others. That's, again, the whole goal here is to really where as much as we possibly can. So go get yourself tested. And then the other key part is if you do feel like you have been exposed, if you can do it, really try to quarantine, really try to stay at home for those 2 weeks and avoid, if at all possible, situations where you might infect others. Again, another one of the big elements of COVID-19 is that you can have the disease and not know it, right? You can be infectious and not know it, right? So you could have gone to the protest, not shown any symptoms, but then spend time with somebody else, friends, loved ones, et cetera, and you may be in danger of infecting them. So if you are in a situation where you feel like you did come in contact or were exposed to somebody that COVID-19, or were in a high risk situation, I would recommend getting yourself tested if at all possible, and then trying to give yourself 2 weeks of quarantine and remove yourself from the population in that off chance that you do have it.
Is there any type of medicine or treatment that works against COVID-19 at the moment? And I'm going to guess it means, more over-the-counter type of medications.
Yeah, so we talked a little bit about this before. The one treatment that we know has some positive impact is remdesivir, that one particular drug. Unfortunately, because this is a brand new virus and we're still learning so much about it, we don't yet have other treatments or therapies to it yet. But this is the part where we got to be optimistic. The research community is working so hard. It's been so inspiring to see that group come together. And there's so many different therapies that are being developed and tested right now. And so in the coming months, I think we'll see more therapies start to emerge that will have an impact in treating COVID-19.
Is it okay to go to your doctor's appointments? And another asks, I've seen several ask about the dentist. When should we be going to our doctor's appointments? Cancel them or postpone them? Sorry, Doc. I think it's my internet, but is it okay to go to your doctor's appointments? And when is it okay to go to your dentist as well?
Yeah, another great question. So here, I think you want to really pay a very careful attention to the prevalence of COVID-19 that's in your area, right? And again, for myself in Massachusetts, I'm feeling pretty safe about it just because the prevalence of the disease is low. But I would, connected to your doctor, I would definitely talk to your doctor and ask them and get their specific advice. I think they'll have a much better sense of the risk profile that's possible in your area. So I would really encourage folks that that do have questions about that to contact their doctors and ask them. Same thing with your dentist too. Obviously dental work is another type of a situation where, you got your mouth wide open, there are people in very close proximity to you. So I would contact your dentist and ask them as well and get their recommendation and advice.
All right, Doc, we have before Instagram just cuts this off. I know it cuts it off at an hour. But I have one final question for you.
Yeah, please.
And that is, where do you see us in the winter time? Do you see us back to normality? Do you see us in a second wave? What is your opinion what is your opinion or prediction on where we go from here?
I wish I had a crystal ball to tell you. It's one of those things, if we could have predicted 3 months ago what would be happening right now, it's just the world changes so fast. This disease is we're learning so much about it, and its impact is being felt so differently depending on where you are. Even in the United States, that we talked about, state by state, there are so many different kind of ways that communities are being impacted and are facing COVID-19. So I would say, you know, for myself, like I study the data pretty religiously every single day. I'm looking at, you know, the number of cases and what's going up and what's going down in different parts of the world and in throughout the United States. So I would just try to track that data closely in your region if you can. In general, if you're in the United States, for example, your state has really great should have some good public health data. Ideally, there is some communication that's happening in your state on a regular basis, so you can learn about is the infection going up or down. Again, as I mentioned before, 19 states in the United States, COVID-19 is on the rise. It's going down in about 22 states, which is really good, and there are 9 states where it's holding steady. But that's where we are today, right? What happens in the future depends so much on us and what we do. If we can, and this is, I think, one of the final points to, we can get everybody wearing masks, like we talked about, that can do such a huge, can make such a huge impact on keeping ourselves safe and keeping the transmission rate low. So I would encourage everybody, when you're out in public, wear that mask. And if we all did just that, right, I think we would, if we talked in the winter, TJ, we would say, you know, we're in a pretty good place right now.
Nice. Okay. Well, thank you so much, Doc, for joining us and informing my following and my fan base. I have one more thing to tell everyone is to go follow Beat the Virus at BEAT the Virus, where you can get a lot of information. I treat this very seriously. You know, I've heard too many horror stories and seen too many people sick for me not to do this. And again, I thank you for joining me and informing us. And please, you guys, keep this on your radar. Don't. I know it's tough. I know it's frustrating. I know we want to get back to normal. This virus is, and respect what you can do to fight it. So, but again, Doc, on behalf of my following and fan base, I want to thank you for joining us and informing us. And that's it. Is there anything else you wanted to add?
Just to thank you, TJ, again. I think, you know, I appreciate so much you opening up your platform to spread awareness and spread facts about COVID-19. You know, there's a lot of just confusion out there. So I really appreciate you for using your platform for this. And yeah, you know, again, you know, I'm David Sun Kong. I'm also on Instagram at David Sun Kong. You can find me there. If you have questions, you can feel free to ask me as well. And again, Beat the Virus is such a fantastic campaign, and we'll also be answering questions if you have them. And we really look forward to working with TJ on more outreach, and just appreciate you so much for everything you do. So thank you for all the great energy that you put out to the world and all the knowledge you're helping to spread as well. So thank you so much.
Thank you, Doc. Take care, okay, man?
Okay, take care. Bye-bye.
Bye. So there we go. Our second, and hopefully I'm going to keep doing it. Maybe in a couple of weeks. We'll see what's going on, but I just want to make sure we're all informed and we are protecting ourselves and our family and our communities as best as we can. Sending each and every one of you guys so much love. I apologize if the internet wasn't acting properly. I don't know what's going on. But again, I love you guys. Take care, and I'll see you next time.